Hello, this is David Airdrie with Clot Conversations from ISTH 2025. Thank you for joining us today. I'm pleased to have with me today a guest host, Dr. Vinny Bagirith, and he's going to be interviewing some of his students from McMaster about their recent research and that they're presenting here at the ISTH. So I'll pass it over to Vinny right now.
Thank you, David. It's exciting to be here at this conference. There's a lot of interesting things going on, and we're very fortunate this year to have a really talented group from McMaster doing thrombosis work, some of whom I've been working with very closely. And I'm going to be asking them some questions about their research as we go along. First, I'd like to introduce Amulya Bagirith. And there is a relation. He is one of my relatives, and we've been fortunate to work together. Amulya is a student at University of Western Ontario. He's been working on a project looking at a computerized decision support system for periprocedural management of anticoagulation. Amulya, can you tell us a little bit about that project?
Yeah, for sure. Thanks for the great introduction. Yeah, so the project is centered around periprocedural anticoagulation management. And so we created a computerized decision support system, or CDSS, which is an algorithm, an app we created that can document when to start and stop anticoagulation based on high, moderate, or low-risk surgeries. So the study was conducted at Hamilton General with a retrospective review of 50 patients, and they were compared with what the CDSS recommended, what the physician did in clinic, and what the expert guideline says. And so the results that came out were very interesting. Because this was an academic center, we expected the results to be a little higher. And so we found 92% concordance or agreement, which is the exact same dosage of anticoagulation at the exact same time, before and after the procedure, between our CDSS and the expert guideline. We found about 80% between the expert guideline and then what was done in clinic, and then we found a lot lower between what was done in clinic and our guidelines at about 72%. So future steps are stemming around doing it at a non-academic center and internationally to see where we expect greater variance between dosage recommendations.
Oh, this is great. Thank you, Amulya. And I should just note that a lot of this work is based on developing a tool that Thrombosis Canada has, which is the periprocedural management of anticoagulation tool, which can be found on the Thrombosis Canada website. Thank you, Amulya. Next, I'd like to ask Dr. Alejandro Godoy, a vascular medicine specialist from Cordoba, Argentina, who is doing a fellowship with us at McMaster. Alejandro, why don't you tell us about your project?
Thanks, Vinny, for the presentation. Well, we make a retrospective international study trying to find what happened with the patient with mechanical heart valves that undergo to any procedures. We try to analyze the bridging approaches to the patient, and we try to compare and make a follow-up in the patient to 30 days and try to see what happened related to the bleeding and thromboembolic outcomes. It was a good, it was an important study that we found 553 patients that undergo to different procedure and they have different approaches, and we found that it wasn't a correlation probably with the use of low molecular weight heparin and the risk of bleeding. We make several different analyses to try to make more uniform the curve of patient, and we found that probably it's a relationship, and most important, a low rate of thromboembolic events. So, well, probably now we will need a randomized control trial to see which is the best approach to this patient. I think that is going to give us the correct answer. Thank you.
Thanks, Alejandro. This is going to be it's very informative data, and hopefully we can start taking those next steps. Also, really neat to see, and Alejandro did a lot of work bringing together with Dr. James Duquetis, bringing together a group, a multinational group together to work on this. So that's really exciting. Another example of where Canadian centers are leading across the world. Thank you, Alejandro. Next, I'm going to talk to Thegvir Garewal, who is our a student joining us. he will be starting medical school at Queen's University and has been a student at McMaster very recently. Thegvir, welcome. Why don't you tell us about a sub-analysis you did of this AMBER cohort?
Yeah, thank you for the great introduction. So going off of what Dr. Alejandro said, my study was sort of born out of those results, and I helped him with all of the entire AMBER cohort. So about 160 of those 500-ish patients, they underwent gastrointestinal procedures. And as they all had that very specific kind of aortic mechanical valve, we looked at how their outcomes were different, especially since they had those specific procedures done. I just did my talk this morning, and basically our conclusion is that we need more research, and our analysis that I spoke on, and that'll be in the literature soon. So keep a lookout for that one to all the listeners. Our analysis is actually the only one, to our knowledge, looking at patients who have aortic mechanical valves and who had GI procedures and subsequent bridging. So especially, with so many Canadian centers, including Hamilton, Toronto, Sunnybrook, we collaborated with our neighbors that were visiting here at the conference to get some great results. And I'm so happy to share it here today and to you listeners.
Well, thank you, Thegvir, for that. That's really exciting. And as you mentioned, we don't have a lot of data on this a really important cohort type of patient. So exciting, and hopefully we'll be able to get more answers as we go along. Next, I'm going to talk to Julia Cherubim, who is a medical student at the University of Ottawa and formerly a student at McMaster University. And Julia, why don't you tell us about the research you've been doing?
Okay, thank you, Dr. Vinny. So, hi, I'm Julia, and our team looked at hypoattenuated leaflet thickening, or HALT, a form of subclinical valve thrombosis that can occur after a transcatheter aortic valve replacement, or TAVR. And so, TAVR is most commonly performed in elderly patients with aortic stenosis, but as the procedure expands to younger and lower risk populations, HALT is becoming an increasingly greater concern due to its potential to cause hemodynamically significant valve deterioration. And so our aim was to identify both patient and procedure-related risk factors for developing valve dysfunction associated with HALT and to assess for the predictors of HALT recurrence. And we did this by conducting a retrospective cohort study at Hamilton General, collecting data from January 2019 to October 2024, identifying 62 patients with TAVR-related HALT. And so for inclusion of HALT, patients were required to have confirmatory leaflet thickening on CT. And in most cases, this imaging was performed due to elevated aortic valve gradients observed on echo. And most patients were treated with warfarin for 3 months, after which an echo was repeated every 3 months to assess for improvement. If valve gradients did improve, warfarin was stopped, and a follow-up echo was done every 4 to 6 weeks to monitor for recurrence. And recurrence was defined pragmatically as a elevation in gradients requiring the patient to restart warfarin. And so we retrospectively applied VARC-3 criteria to classify valve dysfunction, but treatment decisions were based not on these stages, and we did not conduct a sub-analysis based on the VARC category. So our definition of recurrence, again, was independent of VARC-3 and was based on the re-elevation in those mean gradients. And in many cases, this included a rise of 20 milligrams of mercury or more after their initial improvement off of warfarin. And so using their medical records, we collected baseline and procedural data, imaging findings, and clinical outcomes. The average age was 82, with an almost even male to female split. The most common comorbidities were chronic kidney disease, heart failure, and a history of cancer. And the median time from TAVR to HALT diagnosis was about 2 months, and the median time from HALT resolution to recurrence was about 3 months. And so kind of our major findings here were that in our cohort of patients with valve dysfunction associated with post-TAVR HALT, 65.6%, or over 2/3 of patients, developed hemodynamically significant valve deterioration. And warfarin therapy did lead to an improvement in mean valve gradients in the majority of treated patients. However, among those who initially improved and had warfarin discontinued, 27.4, so almost about 1/3 of those patients, experienced a reoccurrence requiring a reinitiation of anticoagulation. And also, last thing, in our study, we did identify 2 statistically significant predictors of recurrence, which were male sex and multifocal leaflet involvement. So yeah, that was our study.
Thank you, Julia. That's fantastic work, and in a patient population that's really of increasing size and importance. And it's really exciting that we have rising stars like you to take over and lead these areas. and that goes for this entire group. You can see we have some really exciting and impactful research coming up from junior members. And it's just an example of the way that Canada is leading research on the international stage. So thanks for the opportunity, David.
Thank you all for participating. It was great to have you on our podcast today. It's been great here at ISTH being able to interview and talk to so many Canadian researchers leading the way for global research in thrombosis. And thank you all for listening to Clot Conversations on Thrombosis Canada. We appreciate your support and hope that you will subscribe to catch future editions of Clot Conversations. Check out our website at thrombosiscanada.ca, and the notes for the podcast will include links to relevant research and materials. Have a great day.